research in childhood neurodevelopmental disorders with a financial advocacy grant from Global Genes USA. We are focusing on rare disease, DMD and SMA, which are the two commonest rare diseases. So we started this journey from 10th of August and we are finishing our series of webinars. We have had 2 webinars every day. So we have understood what is this SMA, what is DMD, how do you diagnose, how early diagnosis is important, what are the treatment options, what is the multidisciplinary holistic management, what about the newer drugs which are available, how the multidisciplinary care should be taken to the periphery, and how what are the myths and all about the new drugs. Then also because there is a long-term progressive condition in which the child deteriorates, तो उसमें क्या है, how to break the bad news to the parents, and how about the transitional care, because we have some patients who are going to go from adolescents to adults. So how a pediatric neurologist should hand over the patient in a proper way, in a proper systematic way to the adult neurologist, so that the parents and the children are comfortable as they're growing up. In cases of a terminally ill child or any person who's terminally ill, how palliative care is important. So from an aggressive holistic care, when to go towards palliative care, and of course, what are the ethical issues with all this, and to destigmatize the issues, because there's a lot of stigma in our country. And most importantly is the humanistic aspect, which is very important, which is not seen very much ignored in our country. And then we've also had discussion needs of a lot of research, and we had a lot of funding agencies and multiple multinational companies, pharma companies who were there. The panel was moderated by Dr. Satish Khadalkar that time. And the government of India's rare disease policy with Dr. Charan had shared, and then we have talked about the prohibitive cost and the insurance ki kya possibilities hai by Dr. Shamika Ravi. And then parent support groups have had sessions, pharma industries with those all globally placed have had discussions. We have had discussions with the media, we have had discussions with NGOs from India and abroad, we have had discussions with pharma people, the pediatric neurologists, and we had the NGOs globally, and that was to understand how to go ahead. And then we have explored the funding options by crowdfunding. We have understood what are the crowdfunding platforms, one by the government of India. Then we had also had those other agencies like Impact Guru and Keto. Then self and parent advocates guided us how to move ahead. And then we also have discussed on the humanitarian access program and the parents and the professionals who were involved with that. Now, today, coming on the last day, we are coming on financial solutions, employees beneficiary schemes, and CSR, other possible options, and what are the long-term sustainable financial solutions. Before I hand over to Dr. Kakuli to introduce our esteemed panelists, and I just want to tell the amount of cost involved, which many of us may not be aware. The amount of cost involved would be like for SMA, you have 16 crore for an individual patient for gene therapy. And then for, if you have considered Spinraza, when you have consider a Spinraza, and in that situation you have 4.2 crores per year, and then you have in the first year, and then you have 2.1 crores every year thereafter. Then regarding Resdiplam, the cost is around 2.4 crore per year, and initially according to the market price, but the Roche company, after it was introduced in after DCJ approval last year in July 2021 in India, and it is available in India, they have given some packages to the parent support groups that buy one bottle, get one free, something like that, which costs around 1.4 crore per year. And for DMD, which are the scenario is not that bright, with not that much improvement, but slight slowing the regression and progression of the milestones, the progression of the disease is slightly reduced. And in that situation, what we have available besides the standard of care and steroid therapies, what we have available are for exon 51 skipping, in which they have shown functional improvement in these patients who are walking at least 300 meters. For exon 53, there has been improvement seen getting dystrophin staining. In exon 45, you have only the safety parameters. For atalurin, which is there for nonsense mutation, there is some motor improvement. Atalurin trial has just now finished in India. It has been European Union approved. but as yet not FDA approved, but other three are FDA approved. And in SMA, all three are FDA approved, and only one is DCA approved. Cost in DMD. Cost in DMD, I want very clearly to understand. We calculated the cost for 30 kg child. So for the exon skippings, it comes around 5 to 8 crore per year. And all these exon skipping are intravenous infusions to be given every week lifelong. That the patient will have to be given intravenous infusion lifelong. Only ataruran is oral, but that has to be also be given lifelong. So that is how the cost is prohibitive. How exactly parents to understand? That's why when we were discussing dilemma hai ki, parents know kitni sari cheezein available hai, but how to go about it. And the government of India schemes have been shared, and Dr. Swasti Charan had shared this week itself that the government is given up to a 50 lakh one time for a patient for the rare disease. And our SMA and DMD come in this category 3 drugs, which are put on portal of Government of India for crowdfunding. So that is how where we stand. So Dr. Kakuli will invite our panelists.
Thank you, Dr. Shefali, for summing up all the sessions we had earlier. Today, we have reached the 19th session, which is the financial solutions, employee beneficiary schemes, CSR, other possible options, long-term sustainable financial solutions. We have with us today Senior Financial Advisor of AIIMS, Mr. Neeraj Sharma. Mr. Neeraj Sharma is having more than 20 years of experience in central government. He is a ICAS, that is a civil servant with now more than 20 years of experience in government financial administration. He has handled accounts, payment, banking, audit, etc. in over 10 ministries in Government of India and is now a senior financial advisor at AIIMS. He is also an authority in procurement and project management and always has a progressive and solution-oriented outlook. He is a staunch proponent of optimizing the use of available IT frameworks for all activities favoring the consumers, that is patients, students, faculty, employees, researchers, etc. He believes in having an idea and working upon it. Welcome, Mr. Neeraj. He is here with us in the facility. Thank you, sir, for coming. We have Ms. Sonal Gudgutia from IIFCL. Thank you, ma'am, for joining in the short notice. She is a postgraduate from Symbiosis, Pune. Sonal Gudgutia joined IIFCL in 2010 and is working primarily in Treasury and Finance team. She has raised fund for IIFCL from domestic and international market in nature of bonds and loans. She has been responsible for raising, managing investment and hedging of funds to ensure the return to the company along with low risk. She has been involved in drafting and implementing the policies of IIFCL. Thank you, ma'am, for joining us. We have with us Dr. Anup Daga, who would be joining with us shortly. We have with us Mr. Daneshwar Yadav. Daneshwar Yadav is a MSSO in the Department of Pediatrics for 18 years. His basic job is to provide socio-economic and psychological support to pediatric poor patients for getting treatment without any kind of hardship. We will also have with us Dr. Madhulika Kabra. She is a professor. She would be joining in the next session, but we will definitely look forward for her. We have with us Mr. Alessandro. Mr. Alessandro has been supportive and had been joining with us for many of the sessions, and he is representing Novartis from Switzerland. He is an international region head at Novartis Gene Therapies. Alessandro is responsible for building and leading a high-performing cross-functional organization for the regions of Asia Pacific, including India, Middle East, Africa, Japan, and China, as well as at the individual country level within those regions. Alignment of Middle East and Africa regions to the new international regions alliance with broader global Novartis structure. In this role, Alessandro is responsible for leading the team that will introduce innovative gene therapies to the market to help babies and their families who suffer from SMA. Previously, Alessandro held position in Roche, Alexion, and Johnson & Johnson. Today, we welcome Mr. Alessandro, who had been there for a few of the prior sessions also. Thank you, Mr. Alessandro.
Thank you, Dr. Kakuli. So I would request Mr. Neeraj Kumar Sharma, Senior Financial Advisor, sir, to kindly give the opening remarks.
Thank you, Dr. Gulati. We all know that India is a populous country and the resources are actually limited in all senses. Like if I say we need roads, we need food, we need safety, security, border security, modern amenities and health. So those resources are to be spread and divided across. So this disparity across our regions and resource constraints bring in the role of the government, which very positively government of India is taking care of. However, when we talk of these rare diseases, uh, you know the 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 resource constraints are still out of they keep those treatments out of the reach of individuals, small enterprises, small groups, families, localities, districts. So as I said, that India is a populous country and disparities, we can actually come together, because the solution lies in putting efforts in research, experimentation with the new drugs, but they are very cost prohibitive as we speak. As Dr. Gulati has already mentioned that single time or one time use is in crores, so nobody can afford, no family can afford. So here comes the role of a framework by the government. There are three kinds of opportunities people or the organization see in this. Some to make optimize their resources and come up with the profiteering. Some come together with the holistic approach that people has to have hope in the solution, and the government which has to take care of one and all. So you know there the the idea is to adopt the patient or adopt the family. So as we move further, we will elaborate on this idea that adopting single patient will not be the sufficient thing. We will have to take care of the requirement of the family where the patient is, because we have seen in India, you know, that has been more prominent in last 2 years, or wherever the pandemic is. The middle class or the lower middle